Hello, we're going to talk today about the gastric sleeve and the technical details that make our gastric sleeve a very effective and safe procedure. Making a gastric sleeve is making a tube out of a bag. This is the gastric sleeve. This is a tube, but there's some characteristics of this tube that we think should be applied, or some technical details that should be applied to make it a safe and comfortable procedure for the patient. And I'm going to mention those. The gastric sleeve should be a very thin tube made in a very regular way. The first step, the first point here that is very important for us is the complete resection of the fundus. This part of the stomach is called the fundus, and this is the part of the stomach that can dilate and receive more food. If you don't do a complete resection of the fundus, the patient can have a very good weight loss during the first year. But after a while, the patient will start tolerating bigger and bigger portions of food, and that can lead to weight regain. So it is very important for us to do a complete resection of the fundus. The following aspect that is important for us is the length of the stomach, of the tube. Most of the groups today start the section of the stomach between 5 and 7 centimeters above the pylorus. We think what we do is we start the section of the stomach 2 centimeters distal, proximal to the pylorus. That makes a longer tube, and we think that resecting this part of the antrum, which is this part of the stomach, can make a difference in the weight loss and in the weight maintenance in the long term. The following step that we apply routinely is a reinforcement of the staple line. After we staple the stomach, we routinely use a running suture to increase the safety of this suture. The following step is called hiatal closure with a gastropexy. This is done now routinely in every patient, even if you don't have symptoms of reflux, because this can correct the symptoms of reflux in those patients who present with them and can avoid the new appearance of symptoms after this operation. And that includes two things. One is a closure of the hiatus, placing some stitches here, and after that we place some stitches at this point, what we call a posterior gastropexy. It's a procedure that was used before for the management of patients with reflux. And the last point that is very important for us is a fixation of the new stomach. This is a very thin stomach that can angulate, can move, and can lead to an increase in the pressure inside the stomach if we get angulation here. So if we apply some stitches to keep it in position, we have a very low incidence of patients with reflux and vomiting, and most of our patients never throw up after the operation. And we think this is in part responsible of this result. So with these details in mind, we've been performing the gastric sleeve for years now, and we've shown that the weight loss is equivalent to the weight loss that we obtain with the gastric bypass, being this a less complex procedure in which we're not altering the absorption of micronutrients, just reducing the amount of food that the patient can tolerate. If you're interested in gastric sleeve, we invite you to visit us at clinicadelaobesidad.org, where you can get more information and you can contact us and see if you're a good candidate for surgery. Thank you.